In today's class, we will be discussing about the role of biomarkers in transplant listed patients. What are the recommendations? So, in a patient on advanced heart failure, when there is an atrial and ventricular wall tension increase, the cardiomyocytes produce natriuretic peptides, brain natriuretic peptide, NT-proBNP. So, these natriuretic peptides aid in myocardial relaxation, help in natriuresis and vasodilatation. They reduce the sympathetic activity and reduce the RAS activation and helps in improvement of the heart failure. So because of the heart failure, there will be increased in ventricular and atrial wall tension, and as a result increased natriuretic peptides will be produced. So degree of elevation is diagnostic of heart failure, but their sensitivity decreases when the patient has obesity or those condition of heart failure with a mildly reduced or preserved ejection fraction. So, as per the recommendation, there are two biomarkers. One is natriuretic peptide and another one is the lactate. The importance of lactate is in already listed patients, it will help in escalating the therapy. It supports the cardiac mechanism of hemodynamic decompensation and hypoperfusion of organs and helps in escalating therapy by adding more inotropes or the initiation of mechanical circulatory support. So, as per the recommendation, class of recommendation 1 level of evidence is moderate with randomized controlled trials is that when the patient is listed for heart failure with advanced heart failure, natriuretic peptide level should be determined at the time of initial evaluation. So, that is a class 1 recommendation. Class of recommendation 1. Class of recommendation 2A is when how periodically it has to be evaluated is not mentioned anywhere, but they have written like periodic assessment of natriuretic peptide in a patient on wait list can be used for early detection of clinical deterioration. So the class of recommendation is 2A and level of evidence is moderate by supported by randomized control trials. So, first initial evaluation baseline natriuretic peptide is class of recommendation 1, level of evidence moderate. So, progressively, like if the patient is improving from heart failure because of reversible causes like myocarditis or anterior wall MI, acute cardiogenic shock, and such condition, progressively significant reduction in natriuretic peptide with meaningful improvement clinically in the absence of other poor prognostic factors. So, the poor prognostic factors are the one which are present in inotropes, natriuretic peptide levels, end organ dysfunction, uh, elevated ejection fraction less than 20%, like I need help is the one which are the poor prognostic factors. And if there is in the absence of such poor prognostic factors, who have improved significantly with guideline directed medical therapy, we can remove the patients from the wait list. So that is the class of recommendation 2A and level of evidence is weak with the limited data. And in patients with cardiogenic shock, that is already patient is in shock or suspected cardiogenic shock, monitoring of blood lactate levels allows for stratification of severity and can be used to guide treatment escalation. That is a class of recommendation 1 and level of evidence is also weak with the limited data. So that is level of evidence is weak. So blood lactate that is already in patient on cardiogenic shock for escalating therapy severity, so guide treatment further. So that is the recommendations by the International Society for Heart and Lung Transplant. So class 1 for initial evaluation of natriuretic peptide and lactate in cardiogenic shock. So lactate more than 2 millimole per liter. So as per the Society for Cardiovascular Angiographists and Interventionalists, there is A, B, C, D, E, 5 types of cardiogenic shock, and type C is the classic one in which there is hemodynamic instability with hypoperfusion. So in that lactate will be elevated. So on from that stage, further escalation of therapy is based on whether the lactate is elevated or not. But we should be careful that even if there is a normal lactate, there can be signs of other end organ hypoperfusion due to heart failure. That should be taken care of. So lactate is not the only marker. And there are conditions in which there will be a normal heart function with a raised lactate, like other local tissue ischemia, bowel ischemia, like that. So that is the recommendation regarding the biomarkers. Thank you.